Hello, I am Gugu Bambo, all the way from South Africa, and today we have Professor Kevin Fenton. We are at the 66th LIYSF. Welcome, Professor Fenton.
Thank you.
It is good to have you here.
Great to be here.
I'm going to ask you a couple of questions. The first one, in 2020, you were named the second most influential Black person in Britain, a recognition of your leadership in public health. Can you tell us about your journey into public health and what inspired you to focus on improving health equity and inclusivity?
Well, I decided to do public health right at the beginning of my training in medical school. And I decided to do public health because I was so inspired by other public health practitioners who told us that medicine can be used not only to improve the health of one person at a time, but you could use your medical training to improve the health of communities, of countries, of societies, improving and protecting the health of populations. And I remember so clearly that inspired me to think about using my medical training differently. Also, over the past 3 decades, I've had the privilege of working on big public health issues, from the HIV epidemic in the 1990s to epidemics of infectious diseases such as tuberculosis and the COVID pandemic. In the last decade, I've done work here in the United Kingdom and around the world on obesity, hypertension, heart disease, and mental health. And in all of those programs, it's about improving the health of populations, engaging communities, and really creating healthier people and healthier economies. And that's why I've done public health, and that's why I'm so passionate about what I do in public health. And the recognition of being the second most recognized or most influential Black person in Britain came at a time when I did work on the COVID-19 pandemic, and I had to be a visible leader speaking to the country about the COVID pandemic and what we all could do to protect ourselves. It's a real honor, but it comes from my long experience in public health.
Wow, that is so impressive.
Oh.
The next question is, what have you found to be the most persistent barriers to tackling systemic health inequalities, and how can we address them?
So there are many barriers to addressing systemic inequalities, and systemic inequalities are really important because it means that not everybody experiences health challenges and health threats in the same way. In fact, if you are poor, if you live in more disadvantaged parts of your community, if you don't have education, if you don't trust the health services, you tend to have worse health outcomes. So understanding those health inequalities and those systematic differences are really important to improve the health of the population. Now, there are 3 barriers which really prevents us from dealing with those inequalities. And the first is that oftentimes we don't talk about the inequalities, right? There's no data. So if you don't have the information, then you can't talk about the differences, and therefore you're not able to address them. The second barrier is that people often say that, okay, we know that there are differences, but if we're going to help everybody, it's going to cost too much. So let's not do that.
Okay.
And we now know that that's not true either, because oftentimes some of the most vulnerable communities, through partnership and bringing them together to co-produce and to find solutions, you can get cheaper solutions, which are even more effective. And then the third barrier that we have when it comes to addressing these systematic inequalities is the fact that oftentimes governments and systems are really concerned about making a difference, and they do for 1 year or 2 years. And then what happens? The funding stops. And so we have a history of lots of great programs that we've done to address women's health, young people's health, that may last for 2 or 3 years, but are not sustained. So the other barrier to addressing inequalities is the sustainability of our interventions. So all of those things are important. We have to have good data, we have to engage with our communities, and we must sustain our efforts in order to reduce inequalities.
That was so insightful. The third question is, what recent global health challenges have taught us about building stronger, more inclusive health systems for the future?
Yeah, we're learning all the time about what we can do to do things better. And I have a saying that when we know better, we must do better. right? In other words, all of the experiences that we're having, whether through our HIV response or through the COVID response, or the work that we're doing now on tackling air pollution, they all give us clues in how we can do things better. And we now know that some of the things that we can do better are getting better at collecting data so we can understand how diseases spread in a population and where we need to target. We know we can do better to engage our communities better and making them part of the solution. We know we can do better with engaging politicians on the importance of thinking not only about developing high quality clinical services, but to think about the health of the population and how you can get good jobs and good environments and the importance of healthy environments for good health and therefore great economies. So all of those are lessons that we're learning to do things better. And that's what I'm interested in doing, that we don't forget that for any problem that we have ahead of us, whether it's climate change, whether it's environmental challenges, or whether it's chronic diseases, the tools for addressing them, we know. And when we know better, we can do better.
I totally agree with that, Professor. The fourth question is, public health bridges science, policy, and communities. What approaches have you found most effective in building trust and involving diverse groups in health programs?
Yeah. So in the pandemic, trust was a really big determinant of whether you got tested, whether you got a vaccine for COVID, or whether you listened to the government's messages on COVID. There are many communities across the country and all over the world who have felt left behind by their governments and didn't trust health messaging coming from government. And they were most likely to be negatively impacted by the pandemic. So I talk about trust as being a little formula which I use when I'm teaching about trust. So trust is equal to truth times consistency times time. In other words, you build trust when you're truthful. You say to people, this is what I know and this is what I don't know, but here's what I'm doing to deal with it. The second is that you have to be consistent. You can't say to people you're interested in helping them today and then leave them tomorrow. That's how you lose trust. And what we've learned is building that consistent relationship is critical. And then the third thing for trust is time. You cannot build trust for communities that have for decades been left behind overnight. You need to be in the business of building those relationships, being consistent, and giving time for trust to build. And oftentimes, we don't have the time for that to happen. And what happens? You lose trust. So, armed with that little formula, trust equals truth, consistency, and time, gives us a sense of what we need to do differently moving forward. We're doing a lot of work in London now on trust for heart health and how we help Londoners to think about getting their blood pressure checked and so forth. And we're using that formula about being honest with Londoners and being consistent with our messaging and developing our program over 5 years. It's not a one-year program because we want London to be the healthiest heart city in the world. And we realize it's going to take time. That's an example of how we do things differently with trust.
That is so true, and I believe that the formula does work.
Yeah.
The last question.
Sure.
What key skills and qualities should students develop if they want to drive meaningful change in public health and social justice?
That's a great question. All right, so number one, recognize that the credibility you have is from speaking to the evidence. Yeah. Lots of people have opinions, but very few people know what the data says and has the evidence to back up those opinions. So if you want to be credible in influencing policy, you need to know the data. And you know the data by either being a good researcher or knowing how to understand and how to find the research to help you to make your argument. So you will never hear me giving my opinion, but you'll always hear me say, here's what the data says, and this is what we can do. So your credibility is based on evidence. Second, understand how to communicate. It's really important. Why? Because as we said in the lecture today, everybody now is on TikTok, Snapchat, and everybody can speak to an iPhone. And before you know it, you're being seen by millions of people. Those of us who want to influence policy need to understand how to communicate effectively. On any given day, I'm speaking to politicians, I'm speaking to members of the community, I'm speaking to business people, I'm speaking to academics. I have to be a clear communicator. I have to be a powerful communicator in order to land my points, but also to be a good leader as well, a visible leader. So evidence, communication. The third thing I'd say is a bit of passion, right? If I'm not excited about what I'm doing, how can I expect anybody to be excited? If I'm not creating a vision that you want to get behind, why should anybody follow me? And in this day and age, it's passion, it's that evidence, it's that vision for change that gets people. People want to be led and they want great leaders. So stepping up into leadership and being seen as a leader is perhaps the third thing that I would say, which is really critical in this time. I hope that helps, and I hope that inspires other young people about things that we can all do to make that difference, because we need our presence to be visible and to make an impact in every room we're in every community we're in. We have to have that purpose, I think.
Thank you for joining us, Professor. That was so inspirational, and I believe that you are an inspiration to many young people out there. Thank you for being here, and thank you for giving time to answer my questions.
Wonderful. Well, thank you for the great questions. It's been a real pleasure to speak with you today. Thank you.
Thank you.
Thanks.